Hello everyone, welcome to Physiobrainary. In this video, I'm going to explain in detail about the nervous supply of the heart or your nervous innervation of your heart. Coming to the contents, by the end of this video, you will be able to understand about the sympathetic fibers that supplies the heart, parasympathetic fibers that innervates the heart, cardiac plexus, and what is superficial cardiac plexus, and what is deep cardiac plexus, and what are the clinical significance in the innervation of the heart. Coming to the introduction, the heart is supplied by the sympathetic and parasympathetic fibers via the superficial and deep cardiac plexus formed by the parasympathetic and sympathetic fibers. So the heart is mainly supplied by your superficial and deep cardiac plexus. And the parasympathetic fibers are derived from the vagus nerves and they are cardio-inhibitory. So parasympathetic means inhibition. Hence their stimulation causes slowing of the heart rate and constriction of the coronary arteries. So parasympathetic fibers will be supplied or derived from the vagus nerves. And these parasympathetic fibers are cardio-inhibitory. So that means their stimulation causes the heart rate to get decreased and there will be a constriction of the coronary arteries. And next is the sympathetic fibers. So they are derived from the upper 3 to 5 thoracic spinal segments, and sympathetic fibers are cardio-acceleratory. Hence their stimulation increases the heart rate and causes the dilatation of the coronary arteries. So sympathetic fibers are cardio-acceleratory. That means they increases the heart rate and causes the dilatation of the coronary arteries. So this is the oral diagram that explains in brief about the deep cardiac plexus and their branches, and the superficial cardiac plexus and their branches. So this will be explained in detail in the upcoming slides. So coming to the cardiac plexus, first classification is the superficial cardiac plexus. So this lies below the arch of aorta, in front of the bifurcation of the pulmonary trunk, and just to the right of the ligamentum arteriosum. So you can see here ligamentum arteriosum is present over the nearer to the superficial cardiac plexus, and the cardiac ganglion or reservoir lies closest to the ligamentum arteriosum. So your superficial cardiac plexus is situated nearer or right side to your ligamentum arteriosum. So it is formed by the superior cervical branch of left cervical sympathetic trunk and inferior cervical cardiac branch of your left vagus nerve. So it is supplied or it is formed by the inferior cervical cardiac branch of the left vagus nerve and superior cervical cardiac branch of the left cervical sympathetic chain. And distribution, the superficial cardiac plexus gives branches to the deep cardiac plexus, right coronary artery, and left anterior pulmonary plexus. And next is about the deep cardiac plexus. The deep cardiac plexus lies in front of the bifurcation of the trachea behind the arch of aorta. So it is located anterior to the bifurcation of the trachea and posterior to the arch of aorta. It is formed by the all cardiac branches derived from the 3 cervical and upper 4 or 5 thoracic ganglia of the sympathetic chains, except the superior cervical cardiac branch of left cervical sympathetic chain, and all the branches of vagus nerve and recurrent laryngeal nerves except the inferior cervical cardiac branch of the left vagus nerve. Why? Because superior cervical cardiac branch of left cervical sympathetic chain and inferior cervical cardiac branch of the left vagus nerve is innervated or formed by the superficial cardiac plexus. So except these two, all the branches will be derived from this is forming the deep cardiac plexus. So this is the representation, parasympathetic contribution and the sympathetic contribution of your deep cardiac plexus. Except the superior cervical cardiac branch of left cervical sympathetic trunk and inferior cervical cardiac branch of the left vagus nerve. So this will be going for, or this will be supplying the superficial cardiac plexus or formation by these two nerves, that is the superficial cardiac plexus. And coming to the distribution, the right and left half of this deep plexus contributes branches to the corresponding coronary arteries and pulmonary plexus and separate branches to the atria. So this is the diagrammatic representation which I informed earlier in the earlier slides, and that is about the superficial, how the superficial and deep cardiac plexus are formed. So the superficial cardiac plexus is formed by the inferior cervical cardiac branch of the left vagus nerve and superior cervical cardiac branch of the left cervical sympathetic trunk. So these two will be forming the superficial cardiac plexus, and all the other cervical ganglion in middle, inferior, and thoracic. So T1 to T5 ganglions of your both right and left, as well as other right vagus, all branches of right vagus and left vagus nerve, that will be forming the deep cardiac plexus. And coming to the clinical anatomy, so that is cardiac pain. So cardiac pain or ischemic pain caused by an incomplete obstruction of the coronary artery. So axons of pain fibers conveyed by the sensory sympathetic cardiac nerves reaches the T1 to T5 segments of the spinal cord, mostly through the dorsal root ganglia of the left side. Since this dorsal root ganglia also receives sensory impulses from the medial side of arm, forearm, and upper part of the front of chest, the pain gets referred to this area. So angiogenic pain is referred towards this area, that is your medial aspect of your arm and the forearm. So viscera have low amount of sensory output, whereas skin is an area of high amount of sensory output. So pain arising from the area of low sensory output area is projected as coming from the high sensory output area. So that is the pain arising from the heart, that is the viscera, that is having a less amount of sensory output, but the other area that is the referred pain area, that is over the medial aspect of arm or forearm, is a skin area that is having a high amount of sensory output. So that will be projected. So the pain arising from the viscera, that is your heart, will be projected as the pain that is coming from the medial aspect of your forearm or the arm. So that is why angiogenic pain is mainly seen or mainly referred to the medial aspect of your both arm and the forearm. So next is the summary. So just a quick recap. The first question is parasympathetic fibers are derived from the answer is vagus nerves. So parasympathetic fibers are derived from the vagus nerves, and sympathetic fibers are derived from upper 3 to 5 thoracic segments. So sympathetic fibers are derived from the upper 3 to 5 thoracic segments, and the parasympathetic fibers are cardio inhibitory. So the parasympathetic fibers are cardio inhibitory, and the sympathetic fibers are cardio acceleratory. So the sympathetic fibers are cardio acceleratory. The heart is supplied by the cardiac plexus. The heart is supplied by cardiac plexus, and C plexus, that is the cardiac plexus, is formed by the superficial and deep branches. So the cardiac plexus is formed by the superficial and deep plexus, or deep cardiac, superficial and deep cardiac plexus. So these are the references. So this is all about the nervous innervation of the heart. Thank you for watching this video. Please do subscribe my channel and share this video to your physio friends and fraternity. Thank you.